Across the globe, viral threats are converging in an intricate tapestry of familiar risks and fresh challenges. In May and early June, SARS-CoV-2 test positivity rebounded to around 11% in 73 reporting countries, a threshold last seen during the July 2024 peak, signaling a resurgence that transcends borders. While much of Africa, Europe, and the Americas record low activity, 2 to 3%, hotspots are emerging in the Caribbean and Andean zones, reminding us that COVID-19 remains a persistent presence. At the same time, measles is making a troubling return. Globally, 17 distinct outbreaks have been confirmed in 2025, accounting for nearly 90% of the 1,168 reported cases, up from merely 285 cases and 69% outbreak-linked sessions in same period of 2024. Canada finds itself at the epicenter once more. Ontario alone has seen over 2,009 cases since October, more than the entire U.S. year-to-date combined. In the United States, 1,088 cases and 3 deaths across 32 states mark the largest measles wave since 2020. Gallatin County, Montana, recently reported an 11th case, while West Texas counts 742 cases since January. England is urging MMR vaccination amid surging rates among children. These parallel trends reveal a disturbing truth: measles, a preventable disease, is resurging due to pandemic-era disruptions in immunization programs, vaccine hesitancy, and international travel. Concurrently, mpox continues its silent expansion in Central Africa. Since September 2023, more than 29,000 suspected cases of clade mpox and over 800 deaths have been documented, maintaining WHO's emergency designation. Though largely localized, the impact remains substantial in regions burdened by displacement, poverty, and limited access to healthcare. Other vector-borne threats also persist. A CDC travel advisory flags cases of vaccine-preventable illnesses such as Ebola, measles, yellow fever, polio, and cholera among global travelers. Locally, a salmonella outbreak tied to eggs in the U.S. has sickened at least 79 individuals across 7 states, highlighting persistent foodborne risks. In Africa, Uganda declared its Sudan Ebola virus outbreak over on April 26 after 42 days without a new case. 14 cases and 4 deaths were confirmed between late January and April, making it the nation's 6th outbreak of Sudan Ebola. The African Union, through Africa CDC, swiftly mobilized regional experts to support prevention and containment efforts. At the same time, Middle East respiratory syndrome, MERS-CoV, continues to circulate, with a small cluster of 9 cases, 2 fatalities, reported in Riyadh among healthcare workers earlier this spring. Meanwhile, threats like Yersinia pestis show genetic attenuation, and Nipah virus readiness continues behind the scenes, reminding us these pathogens await potential resurgence. Zooming out, the emergence of these threats is tethered to a larger pattern. Zoonotic spillovers remain central. 75% of emerging pathogens originate from animals. Climate change, urban sprawl, deforestation, and human intrusion into wildlife habitats accelerate this interface. Global travel, porous immunization systems, and waning investment in public health infrastructure compound the risk. Yet, humanity is not defenseless. Scientific advances, such as scalable mRNA vaccines tailored to evolving viruses like H5N1 and SARS-CoV-2, bring new strength. Enhanced genomic surveillance and wastewater monitoring are being deployed in high-risk regions of Africa, Southeast Asia, and South America. Unified efforts combining cross-border cooperation, as seen in Uganda's Ebola response, and proactive travel vaccination policies for measles, indicate incremental progress. Still, these gains must be cemented through stable funding and global equity. Past outbreaks offer sobering lessons: SARS in 2003, H1N1 in 2009, Zika in 2015-16, and COVID-19 in 2020-21. Each revealed institutional gaps in surveillance, vaccine distribution, and global coordination. Today's multifaceted viral landscape, comprising COVID-19 resurgence, measles outbreaks, mpox, Ebola, MERS, salmonella, and vector-borne diseases, demands sustained vigilance. Social consequences include overwhelmed hospitals, pressure on public health budgets, vaccine distrust, and propagation of misinformation. At the same time, travel advisories, enhanced vaccination schedules, and community engagement reflect evolving responses. To protect our future, we must reinforce immunization, advance equitable vaccine access, maintain vigilant surveillance, and support scientific innovation. Global cooperation, not complacency, offers our strongest shield. In a world of shifting microbial threats, our preparedness today shapes the outcome of tomorrow's outbreaks.